सर
कतिजना थियो बिहान अमित?
सर ब्याक क्लासमा 115 नियरली
ए अहिले पनि आउँछ?
14-15 फ्लक्चुएट
ओके
आउँछ
आउँछ नि ल एकछिन ठिकै छ। अनि कस्तो भइरहेछ क्लासहरू?
सर राम्रै भइरहेछ। लास्ट क्लास फेल भयो
योभन्दा अगाडि के थियो?
सर। मेडिसिन
ए के भएछ?
खै सरसँग एक्सेस थिएन इन्टरनेटमा अनि टिचिङ
को
मेटेरियल
सर?
पनि त्यही भएर।
कसको?
सर एकैछिन सर नाम हेर्छु।
ए
एसी देवकोटा।
ए त्यहाँबाट सर ए अनि अरू क्लासहरू कस्तो भइरहेछ?
सर त राम्रो भइरहेछ एकदम।
तिमीहरूको यो विक कति 30 के अरे 3-4 क्लासेस छ एभ्री डे? नेक्स्ट विक
सर
आयो?
एभ्री डे छैन सर, नेक्स्ट विक आएको छैन।
ए अब 3 हुन्छ होला सायद है, 3 गर्ने भन्ने सुनेको थिएँ।
सर यो विकमा नि 3 नै थियो, एडभान्स डे मात्रै 2 क्लासेस थियो।
ए आज अनि किन 3 देखि छ यो क्लास?
सर बिहान एउटा मात्रै भयो।
अनि बेलुका चाहिँ 2टा थियो?
हजुर सर।
ए ए ए ओके 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 के गरौँ त, स्टार्ट गरौँ त?
हुन्छ सर अब गर्दा।
Okay, 100 plus I think they will come. Just I'll start. So what was taught in your last class? Somebody else say. I want other people speaking. Somebody else. My name belongs to. I'll just call out the name. Wait. Okay. नितिन कहाँ छ? नितिन छ त्यहाँ? सुनिरहेछ नितिन? नितिन are you there? मैले बोलेको सुनिरहेछ नि हैन? नितिन are you there? Pranisha? Pranisha?
Yes, sir.
लास्ट क्लास के भएको थियो कम्युनिटी मेडिसिनको?
Communicable disease epidemiological introduction, important. अनि infectious disease infectious disease र communicable disease को differences. अनि basic concepts से epidemic
कस्तो
outbreak.
विनिता म्यामको थियो?
Yes, sir. विनिता म्याम को थियो।
अनि त्यसपछि चाहिँ सेकेन्ड क्लास मेरै होला हैन?
हजुर, the second हो।
ओके ओके somebody नाम बोलाम कि will somebody speak? Infectious र communicable, what is the difference between them? Somebody else? बोलौँ? नाम नबोलाम न? आशिष अधिकारी ल स्पिक अप. What is the difference between infectious and communicable? खै यसरी when I call out your name and you don't speak, I'll make sure that you are marked absent है. That is not how online classes goes. मेरो clear rule छ. Whenever I call out the name, you all should speak. थाहा छैन भने I don't know भन बरु. If you remain silent, that means you are not listening, you are not online. है त्यसमा केही डाउट छैन है. आशिष अधिकारी are you there? Okay, I'll remove you from the class then. If you don't speak, I'll remove, right? Ashish Adhikari, one last time, are you there? Ashish Acharya? Ashish
Yes, sir.
Acharya? ल कम्युनिकेबल र इन्फेक्सियसको डिफ्रेन्स भन त
सर कम्युनिकेबल डिजिज चाहिँ टक्सिन्स र फुड पोइजनिङहरू हुन्छन् एन्ड इन्फेक्सियस डिजिज कज बाई माइक्रो अर्गानिजम्स
Can infectious disease be called communicable disease?
यस सर
Okay, very good. So basically, they are kind of interchangeable, right? Kind of interchangeable. And most important thing you have to remember is the type of infection. Okay, the type of disease that how the disease is being caused. That is the most important thing. Okay, so at present we are very much in with this SARS-CoV-2 COVID-19, right? So that is communicable disease or infectious disease. Somebody else? Ashish Adhikari छैन है. He's not speaking, so I am removing him from the class, right? Okay. Okay, in between the class, सुन है सबजना, in between the class, I'll be taking your points, taking your opinion. I want it to be interactive class. मलाई यो चुप लाएर म स्क्रिन हेरेर बोल्ने काम चाहिँ म गर्दिनँ. यसको लागि you all will have to support me by speaking whenever I say you to speak. Okay. So I'll start today's class with one of the disease, communicable disease, and there are certain things I'm going to talk about before I start the disease proper. But I'll be talking about in general, and then I'll be talking about the disease as well. Okay. Okay, Kumar Sankalpa, something is wrong with your connection. I think you're being removed. Please come back. Okay. Okay. Can you see the slide?
Yes, sir.
Okay. Mm. Okay, my topic today is, so I think, did I record? Yes, okay. So good afternoon, everyone. Let's start with the class. I'm going to start today's topic, yellow fever, okay? So basically, we are going to talk, there are lots of diseases that we are going to talk in this semester. And all these diseases are communicable diseases. Most of them are diseases originating from organism. Certain organisms are going to be there. Otherwise, like you said earlier, infectious, non-infectious, communicable, those things, it could be some toxins and all. Basically, we are going to focus on disease that can be communicated from one person to another. So that is transmissible from one person to another. Those kind of diseases is what we are going to talk in this semester. Major portion is going to be there, okay? And probably for your exams as well, this topic, this bunch of topics that you're going to study in this semester is going to be very, very important. There are certain things that you have to remember when you study these diseases. I'll just go through the general outline. Since this is the first class of this kind of topic, it's going to get very, very boring. It's going to get very, very lame this semester I'm talking about, not hopefully not this class. The problem with this semester is that you're going to study each and every disease, okay? Yellow fever, dengue, chikungunya, then malaria, Kala-Azar, all those things disease-wise we'll be going, and we'll be focusing in detail one class per disease. Sometimes it'll be multiple class, but most of them is one class per disease. We'll be studying one by one, and we'll be covering the whole spectrum of communicable disease, most important one. But in that communicable disease portion, we'll be focusing on diseases that are of public health importance. Okay, so what do you mean by public health importance? First question of the day. What do you mean by public health importance? Anybody? Anybody willing to answer? Public health importance.
जुन चाहिँ एन्डेमिक छ अहिलेसम्म
Endemic गरेको. Okay. Okay, that's one point. Another would be
So any disease that affects a large group of population.
okay, that affects large group of population. Okay. Anything else? Okay, so anybody else?
Diseases that are easily transferable.
Transferable.
Diseases which are common
Aspect.
among the public.
Okay.
Diseases which are common among the public.
Okay, very good. I think that is the most important one. Common among the population. Okay, somebody said epidemic, somebody high mortality, morbidity, Smita. I think I'll not go with that. More of morbidity, yes. Diseases that is more prevalent in the community. Okay. When I was a student, we did not study about chikungunya. That chikungunya, what we studied, well, it's not a disease of our part of the world. That's what we studied. Okay. Now, chikungunya we are seeing every year in Nepal as well. So that is going to be a problem. So we want you to study that. So we are going to talk about those subjects, those topics, those content which are important as a clinician later on, which with the cases that you might see. So those cases which you might see are the ones that are going to be prevalent, right? So in the that are prevalent in the society at the present, right? So that is what we are going to focus on. So yearly, every year now and then, this list might be updated. And in general, for newer disease, we have got a special topic, emerging and re-emerging diseases. So we try to include that in that topic. But basically, the basic idea is what we try to do is we make sure that we learn about the diseases that are existing in the community at present. We don't want to exclude any diseases. We want to include most of the diseases, and those diseases that are prevalent in this community is the one that is important from the point of public health. Okay, so that is what we are going to study. Now, these communicable diseases at present, the global scenario is such that communicable and non-communicable, there is a big debate going on. Communicable disease or non-communicable disease, and non-communicable disease seems to be the one that's rising every year, that's increasing every year. If you look at the more non-communicable disease, but communicable disease is still there. And the challenges of communicable disease, I think this 2020 is going to be a big reminder for all that communicable disease is something that we should never ignore. The general concept of epidemiology, the general concept of epidemics, the general concept of pandemics, general concept of disease that transmits, how it transmits. So everything we have to be thorough. So if we have the general concept, then we are going to be able to we can more or less explain everything in that line, right? We can't say for sure. For example, with this corona thing, the general thing is virus, okay, antibody will be produced, antibodies will be most likely able to defend the disease for defend the body for a certain while, so reinfection might not be there. That is what we are assuming, right? So that might not be the reality. After a few months, we will come to know about it, but general tendency is that. So we know that epidemics has a curve, it goes up, it goes up, it goes up, and there is a peak. The peak can either come down or it can flatten. So we know many things in general. So we try to study this communicable disease in general. Now you're going to study some 30 diseases or something like that. Now, if you try to study each disease separately, you're going to get total messed up. You are going to mess up how you remember all those things. Okay. So one idea is try to study it in groups. There are different groups of communicable diseases. Some are caused by, some are related to mosquito, some are related to viruses, some are related to bacteria, some are related to parasites. So try to divide them into multiple groups. And if you study in that way, I think it's going to be much easier. Now, second point, why it's going to be easier is first thing, you can generalize the thing. Second thing is that, say, mosquito-borne disease. Now, public health importance in community medicine we are studying because we want to prevent and control the disease. Okay, we want the treatment aspect, but more of prevention and control of the disease. That is what we want. So if we want something to be prevented, if we want something to be controlled, we should know how to prevent it, how to control it. We want to have that general idea how to control certain XYZ disease, right? Now, if you study in groups, what will happen is that mosquito-borne diseases are generally controlled by the same pattern, control the mosquito, right? Isn't that clear? Diarrheal disease, if you want to control any diarrheal disease, all diarrheal diseases generally have got the same tendency, fecal-oral transmission, or even control the, sometimes we would not like to control the disease per se, we would like to control the immediate after effect of the disease. For example, diarrhea has got more than the diarrhea we want to control dehydration. So how do we control dehydration? Let's go for oral dehydrating solution. So preventive aspect can be similar in multiple diseases. So if you study in such a way where you try to congregate all those, and if you try to put a general concept on everything, then it's going to be much easier. Okay, so remember that one very important thing, you have to focus in trying to generalizing, and if you just remember the distinguishing character between them, it's going to be much easier for you all to remember. But this is just the beginning. I'm going to talk about this class. I'm talking about yellow fever. After a few next week I might be talking about dengue, then I might be talking about chikungunya, I might be talking about malaria, filaria. Once the list start increasing, you'll get lost. So try to remember it in such a way that you generalize the thing as much as possible. So you have to remember only a list of things. You study one list applicable for all, and then another list specific for it. Okay, so let's go to this topic, yellow fever. Have you all heard of this term called yellow fever? Have you all heard of this term called yellow fever?
Yes, sir.
Okay, what do you think this yellow fever means?
So it is a viral disease caused by yellow fever virus by Aedes mosquito, transmitted by Aedes mosquito.
Okay. So basically, okay, before I start the disease proper, let's just some general headings for communicable disease. Okay, so you all will be in brief talking about introduction, what the disease is, and then next line would be the what is the problem. Since we are public health, so in public health, what is the problem? What is the real status of this disease in the community? That is what we want to know. Global, local. So after that, next would be epidemiological triad. Now, how does this disease cause? So how does this disease occur in a community or in a person? So we'll be focusing on agent, host, and environment. These three headings we'll be talking. After we know how it causes, then we can relate the transmission. So in transmission, we might study about how it gets transmitted, what is the incubation period, what is the communicability, all those things over here. The next heading would be the clinical features. So what is the clinical features? Now here we will not be focusing on the rarest ones or the most unlikely ones. Will not be focused. We'll try to focus on the most common clinical features that distinguishes this disease from others. Okay, so once the clinical features, will be going on diagnosis. After diagnosis, big treatment. Again, in medicine, in pediatrics, in surgery, in gynecology, you'll be studying in detail about these small headings of diagnosis, everything, treatment, everything. So we'll just try to generalize it over here. And next, and probably the most important one, would be control measures. So we'll be focusing very much on control measures. So how do we control the disease? That's the most important thing in our perspective. So if a class goes for 1 hour, I think control measures should cover somewhere around 20-30% of the class. So that is it's that important. Okay, so we'll be focusing on that. So in this general thing, let's try to study yellow fever, and then we'll come to know what things are going to be taught in this whole semester. It's going to be basically in the same pattern. Okay, yellow fever basically is an acute viral hemorrhagic disease transmitted by infected mosquito. Now, what do you mean by infected mosquito over here? Most important thing over here, infected mosquito. So any mosquito will not transmit the disease. Okay, first thing, for a disease to be transmitted by the mosquito, it has to be infected. So what are mosquitoes called over here? What are mosquitoes called?
Vector.
Vectors. Okay, very good. So vectors is something that you all will have to remember. Okay. Let's wait just a minute. So a vector will only transfer a disease from one place to another, not give the disease itself to, not necessarily just by biting it will come, the disease will come. No, you all can see the slides, right?
Yes, sir.
Yes, sir.
Slide मात्रै देखाएको छ हैन, अरु केही पनि देखाएको छैन नि.
छैन सर, स्लाइडमा चाहिँ.
Okay. अहिले पनि स्लाइड फुल स्क्रिनै आइरहेछ.
अहिले छैन सर.
अहिले के सानो भएको छ कि के भएको छ स्लाइड?
सर त्यो माथिको टुल बार नि देखाएको छ.
ए टुल बार मात्रै देखाएको छ, अरु त क्लियरै छ नि हैन.
सर प्लिज.
Okay. मैले त्यस्तै I am trying to do it in that way itself. Okay, so basically it's a disease transmitted by a infected mosquito. Mosquito is a vector away, and the yellow name comes from because of jaundice. Okay, so jaundice is caused in some patients. Most important thing, although the name is yellow fever, not all patients will be having yellowness. Okay, it's only some patient. This is a tropical disease, prevalent in the tropical area, but most important thing away, it's not really prevalent throughout the country. Africa, Central and South America, those are the regions. I'll show the map later on. Those are the regions that are really endemic to yellow fever. Other countries likely to get, but they have not got. One very important thing in yellow fever, it's a very, very much preventable disease because of an extremely effective, safe and affordable vaccine. And even if the person is infected, good supportive treatment. Again, good supportive treatment is the most important thing. Good supportive treatment will have improved survival rate. And there is no specific antiviral drug for this disease. Okay, so these are the basic things. Now, globally, if you see, there are around 50 countries that are endemic, 44 countries endemic to yellow fever, and majority of them, 33 of them are in Africa, and some of them are in South America, Central America as well. Occasionally, travelers who visit yellow fever endemic countries may bring the disease from that country to yellow fever free country. And one important thing for yellow fever is many countries require proof of vaccination against yellow fever before they issue a visa, particularly if the travelers come from or have visited yellow fever endemic area. So before you go to some endemic region, before you even they issue a visa to you to go to Brazil, they'll ask you to get vaccinated against yellow fever. Otherwise, you'll not be allowed to go to Brazil. One example, okay? There are some 40 something, or I'll show the list again later on. I'll show the map basically. And this is how this disease is being contained in that region only. Anybody going to that region, they ask vaccination. And coming out of that region they try to make sure that that person has already got the infection or they have already got vaccinated, and then only they'll allow them to leave that country basically. And even in our country, anybody who comes from this, actually what is happening is these 44 countries and plus few others, what they are doing is they are controlling the disease by themselves. Number one, they are not issuing visas to others if they are not vaccinated. Number two, they are not allowing people to get out of that country if they are not vaccinated. So those countries are working really hard for containing the disease in their boundaries itself. But our country, what we do, we could get the disease. I'll talk about it in a while. But one coming from those reasons, we'll have to declare this, I came from a yellow fever endemic region, and there's a list and all in the airport and all. So we don't really have to bother that much, but we have to just be aware, okay? And these yellow fever was probably causing major outbreaks earlier in North America. It was a disease of North America basically, and Europe. Large outbreaks have been there over there, and economic development, everything has been disrupted in the past. But now it's limited to very few countries, and estimated there are around 200,000 cases with around 30,000 deaths per year. So death rate, if you see, it's not that high, but we are containing the disease very much controlled in those regions. We see that this chart, I downloaded it today morning itself, and this, although it's 2020, WHO has not released another version of this chart. This slide was made in July 2019. So although more than a year old, I think, yeah, almost a year old, you can see that number of cases if you see over here. Early 80s it was less, and then in 86 and 87 it came down, and then if you see, it has come down and remained down for majority of the region except for a few spikes. Okay, and if you see this bar, one thing you can see above the bar is this blue line and the red line. So blue line and red line is the vaccine coverage. What it's trying to imply is with vaccination, disease rate has come down. That is what they're trying to imply over here. Okay, so WHO estimate this much people have been vaccinated. This blue line is the official coverage thing. So roughly around 50% of the world's population is already vaccinated. It's estimated. In reality, at least 20% is vaccinated. With that, we've got that disease rate very, very less. But interesting figure is that last 3 years, this is increasing really high. 2019, I think it's even more than 2,000, 3,000 cases are there. But anyway, the number of cases has gone so down that it's not a major problem until it's contained really well. Okay, this is the word. So just let me just show you this. Okay, if you see over here, let it just finish once. If you see over here, the number of countries that are endemic to this yellow fever, it's increasing yearly. 2005, this many countries, 2006. I'll just re-show this slide once again. If you just focus on the green color, okay, just wait for a while. Now, if you focus on the green color, if you just focus on the green color from 1960s onwards, very few countries over here, just a few, one country introduced, partially introduced was in this country only initially. And then in 1970s, it went to, in 80s, it went to Africa, and in 82, 83, 84, it started to rise in Africa and some of the South American countries as well. And then in 1990, Brazil got hit. Once Brazil got hit, huge number of cases. And then other African countries also started to rise. And because they did not really contain the disease, vaccination was not a priority, it started to spread. But other countries, they were able to control. But in Central Africa and Western Africa, it was very difficult to control. And with Argentina and other countries also involved, almost all of South America is involved right now. And this sub-Saharan Western African region are all affected with this. Okay, so this is the present day status of yellow fever. And now let's talk about the agent hosting environment. So basically, the epidemiological triad, we call it. Sometimes in exams, you might just be asked, describe the epidemiological triad of yellow fever. Or they might ask, in brief, explain the epidemiology of yellow fever. So you have to focus on agent hosting environment. Okay, this is a basically a viridae group disease, rotavirus family, RNA virus, single strand, and the agent is such that it's actually not meant for humans. It was a forest disease, monkeys and forest mosquitoes. And suddenly humans started to get cases. Were there? You understand some clinical cases? Anybody? Some clinical cases? Anybody would like to? What do you understand by subclinical cases?
Medical attention नआउने cases
Okay, medical attention नआउने. If you say it does not come really to medical attention, it means that they might be having some symptoms, but they're not just coming. Doctor. So other term would be
record नहुने
So asymptomatic cases.
Symptomatic.
Product medical attorney? No. Huh?
हजुर
Gets infected, but yes, very good, Kiran. Asymptomatic, okay, subclinical, kind of asymptomatic. They really come to they have the disease, they get the disease, but they don't have the symptoms, or the symptoms are so mild that they don't really go to the doctors, okay? So subclinical cases. So we don't really see the symptoms. That is the most important thing. So these are the most dangerous ones. The subclinical cases are going to be a really dangerous one because they are able to transmit the disease to others. You don't know whether they have got the disease or not. Exactly what COVID-19 as well. Almost there are papers being published right now saying around 40 to 50% of the cases are asymptomatic. So who knows, I might be already having the disease, I might have given the disease to others. Right? So if I've got the disease and I don't have the symptoms, I'll assume disease with the disease. So subclinical diseases are very, very important ones. Asymptomatic ones are very, very important ones. Okay, so this has got that tendency as well. Next thing is period of communicability. Now this is very important for diseases. Why? Because with the knowledge of period of communicability, we are able to contain the disease with better knowledge. Okay, the better control, we are able to control the disease, contain the disease. So of illness. Yellow fever, somebody has got yellow fever. If the mosquito bites on the first, not infected. It has to be 3 to 4 days. First 3 to 4 days only. Right after a yellow fever, hours after time only I'll be able to rest. Person with mosquito, the period of communicability is 8 to 12 days. So it takes around 8 days for the virus to develop in numbers and in pattern so that it is able to give disease to others. Okay, so this pattern is there. So if you see someone in a house, if let's say someone comes to my house with yellow fever and there is availability of this mosquito, then next day will not be getting the disease. It will take somewhere around 2 weeks for the disease to appear. So those are the general things of communicable disease. For this corona testing, we don't really know these things. Assume the infectivity period is first week or so. We don't know. There's no vector, so we don't have to worry about this communicability period. We don't really know the incubation period. We don't really know how much of them are subclinical. So these are the missing links in coronavirus thing. That's why it's all vague right now. Okay. So these are the things we know. Yellow fever in detail. That's why we have got factful number here, like 3 to 4 days, 8 to 12 days, rather than 7 to 14. They know that it's not 7. They know it's 8, right? So they've given this number. We don't know this in coronavirus thing. So this is all about agent. This is factor. Since mosquito, so basically general thing over here in mosquito, it can bite anyone. And yellow fever, it's immunity is lifelong. Immunity is there. That is one of the most important thing. And infant born to infected mothers are immune up to 6 months, so they are protected. One thing about this occupation is dog will be more dangerous, more like to get the disease, and other things with mosquito. When the mosquito bites, your dress pattern, where you stay, how you live, that also affects. So you have to be thorough. When you study all these diseases, you have to be thorough about mosquito. Okay. Environmental factor. Environmental factor over here is because it's a mosquito vector-borne disease and mosquito is involved. The environment has to favor the mosquito. So 24 degree is needed at least 24 degrees Celsius is needed for the virus to multiply in the mosquito. That's one thing. And humidity is somewhere around 60%. And people, one social factor that is related with this disease, because it comes from the jungle, is that people expanding living areas closer to the endemic forest. So if the forest is over here, and this is the living area, they expand and go closer to the forest, like you would have getting the disease from the forest is increasing. Okay, and next is travel. So you don't get the disease if there is no travel; it stays over there, right? So these are the environmental factors. So with this knowledge, we've developed risk factors, risk zone for yellow fever. So this chart you see over here, let's just focus on this part of the chart. In South American countries, basically this with the risk zone, they have recommended vaccines. What they have said is this yellow region that you see is the vaccine required region. So majority of northern part of South America, they require vaccination. And Sub-Saharan Africa, Central Africa, Western Africa, they require vaccination because the disease is there. So we can really assume the endemicity in this area. Okay, so this is the general thing regarding epidemiology of yellow fever. Anything in yellow fever that you would like to clear? Anything else, Keitha? Anybody? Any doubt? Okay, so transmission. So transmission is by mosquito belonging to Aedes and Haemococcus species, especially Aedes because that's more seen over here. And they've got certain cycles, multiple stages are there: salviatic, jungle fever, or intermediate and urban. There are 3 cycles basically. So what happens is in jungle, in the tropical rainforest, monkeys, which are the primary reservoir for the yellow fever, are bitten by wild mosquitoes, which then pass the virus to other monkeys and it circulates over there. Occasionally, humans working in the jungle may be bitten, and that they bring the disease, and they develop yellow fever and they bring the disease. Okay. Next is this is the salviatic cycle. Jungle. Non-human primates, mosquito, non-human primates, mosquito. It circulates. This is happening for years and years. Then human goes in over there, they bring the disease over here. So over here, what happens is that human, mosquito, human, Aedes is the primary one over here. Haemococcus is for jungle, Aedes is for humans. So in the urban region where Aedes love to live, Aedes love to live in the urban region rather than the rural region. In the urban region, this thing happens. And there's one intermediate cycle as well. Sorry. There's an intermediate cycle as well. Semi-domestic mosquito that breeds both in the wild and household, in fact, both mosquito and people, and increased contact between them will increase the outbreak. So basically in Africa, this is what happening. Both ways, okay? Jungle thing is also happening, urban thing is also happening. That is the intermediate one. So these are the 3 cycles, and this is how it happens. So one thing happens in the jungle, one thing happens in the jungle and the urban areas, and another thing is just purely urban, and we are worried about the urban one. Other cases are very sporadic one, they just bring the disease. Once it comes from this, if it comes from this, if it comes to this, and then it comes to this, then what happens is that it will explode. Okay, it will explode over here. So this human has to go. For this, human doesn't really have to go to the jungle. It's already there, and in low level circulation might be happening, and after a certain time it might go into the urban cycle. So once it comes to urban cycle, because people yellow fever really happens in the area where there is high amount of cases of urban areas, people living in high density, so disease really explodes over there. Okay, so that is the thing with this yellow fever. Large epidemics occur when infected people introduce the virus into heavily populated areas with high density of mosquitoes and where most people have little or no immunity due to lack of vaccination. In this condition, infected mosquito transmits the virus from person to person, and this is how people get infected. Now you see over there, communicability period, if you see over there, the list was 8 to 12 days, right? So Once the mosquito gets the virus, from 8 to 12 days, therefore it has got 4 days. For 4 days, that mosquito can bite numerous people. And Aedes is one mosquito that does not remain happy after biting one person. No, it does not. It wants to bite more and more people. Aedes is not the one that will bite when you're sleeping. So even if you must use the mosquito nets, it's not going to really protect you. Aedes mosquito will come and bite at around, say, around 5-6 o'clock in the evening or early in the morning. Like we have evening snacks and breakfast, that is the time. And Aedes does not really stay outside of the house. It loves to stay inside of the house. This curtain might be hovering Aedes mosquito. So this is the best place. If under the table, best place for the Aedes mosquito. So that's how it transmits. So any diseases associated with Aedes, it really transmits really fast, more than malaria. Malaria, one mosquito will bite one person, finish for the day. Next day, it might bite another one. But Aedes, it'll bite everyone in the room for that day. To get full diet, they'll bite everyone. So diseases associated with Aedes mosquito is more exploding, okay? Explosive. Same thing with dengue. So basic clinical features is incubation period is about 3 to 4 days. I think you'll understand incubation period. After the third day of biting of the mosquito, infected mosquito, the person will get the disease. And yellow fever presents with variety of clinical signs and symptoms. Many of them do not experience any symptoms, subclinical or symptomatic. That's one thing. If they get the symptoms, fever, muscle pain with prominent backache, headache, loss of appetite, and nausea, vomiting is the common ones. Most symptoms disappear after 3 to 4 days, and after that, the person might be fit and fine. Small percentage enter into the second phase, and what happens is that initial symptoms will go away, and within 24 hours of that symptom going away, that person will be sick again, and high fever returns. Several body systems are affected, usually the liver and the kidneys. So if the liver is affected, jaundice develops and bleeding occurs. It's hemorrhagic disease, blood and bleeding occurs, and half the patient who enters the toxic phase die within 7 to 10 days. So majority of the people who get yellow fever will not die. Only a small person will come into the second phase, and among that, half of them will die. Okay, that is the basic things about yellow fever. So yellow fever diagnosis is really difficult in the early stage because it can match with malaria, leptospirosis, hepatitis, or any other hemorrhagic infection, dengue, and all this. It's similar to that. So RT-PCR specific for that has to be done. And later stage, once the antibody is developed, PRNT or ELISA also can detect with precision. So detecting this disease is really difficult in the early stage. Treatment, like I said earlier, no specific treatment is available. Good and early supportive treatment is required. Hemorrhagic means dehydration is important. Dehydration, liver and kidney symptoms has to be preserved, and fever has to be really controlled really well. And anything with viral diseases, that secondary bacterial infection may occur any time. So that is the most important one. So some of them requires prophylactic antibiotics as well. Some might not. So in severe cases, death can occur between 7th and 10th day after onset of the first symptoms. So these are the basic things in treatment. So we don't really have to worry about the treatment, supportive things, okay? Control measures. Now, most important thing, there are 3 ways to control a disease. One, if you've got a vaccine, let's stop people getting the disease. Number 2, if it's a vector-borne disease, let's stop the transmission by stopping the vector. And next is surveillance. What do you understand by surveillance? Somebody please volunteer for this. Anybody? What do you understand by surveillance?
Careful watching.
Careful watching. How?
Sir, on somebody means who are more prone to that area in which the disease is more common.
And then what do we do? Okay.
Then accordingly we can give the vaccinations and medications.
Okay. Diksha has
Case
written
detection,
case detection, Praveen close observation,
regular testing.
screening. Okay, case finding in the community. I think I'll go with Diksha's answers. Case finding in the community. We should be vigilant about this disease. Okay, Prakash, I think okay. Continuous monitoring, observation of the suspected. Okay, basically, what is the meaning of surveillance is that we actively or passively we look for that disease. Okay, actively means anybody with fever, we might ask for test to occur, testing to be done for yellow fever. Passively, patient comes, or doctor suspects yellow fever and sends the sample for yellow fever, and then that comes out positive. So surveillance, active surveillance is important. We really want to closely look into it by doing testing. Okay, you can't just say okay, it could be yellow fever because this person has got fever. We can't say that because it's undistinguishable in the early stages, especially in the early stages. Later stage, it could be again anything. By looking at the features, the coronavirus features that you are, I think, thorough with matches with yellow fever. It's exactly the same initial stage, right? So how will you distinguish it? So active surveillance is all about trying to find the disease in an earlier stage so that we can contain it. Okay. Right now, uh, testing is being done for coronavirus, right? If a testing is being done, say for the doctors, suddenly if somebody comes to NMC and I'm in NMC and they start to do my testing, that will be surveillance. There will be surveillance because my likelihood of getting the disease is higher as compared to others who are staying home. Right? I've been going to the hospital almost daily, so I might have already got the disease if somebody has come with the disease in the hospital. So surveillance, if they come and ask for my sample, that is surveillance. Okay. Likewise,
Sir, sentinel surveillance one as a
sentinel surveillance भनेको चाहिँ sentinel surveillance means that you choose a certain site and then that is what we are focusing on. Okay, for example, Nepal Medical College and all they are around 112 or 80, I forgot the exact number, sentinel sites for major communicable diseases in Nepal. Okay, they are, see, we can't really do surveillance in every sites throughout the country. It's very expensive thing. So what they have done is sentinel sites educate testing facility. For diagnosis you need testing facility, right? The lab has to be educated for, say, for entering fever, culture facility should be there. For dengue, testing kits should be there. So whatever the test is, the testing facilities should be there and people should come to that site in high numbers. So sentinel sites are the ones where sentinel surveillance sites are the ones where people come in high number and it is representative for a geographic reason. That site is that hospital or that site is represented for a geographic reason, and diagnosis happens over there. We don't really send diagnosis other places. Diagnosis really happens over there. So NMC is one of the sentinel sites for EWARS, we call it. And EWARS, under EWARS, there are diseases like cholera and all. So if a case comes to NMC with cholera, what they do is we send that report immediately to the central government. There is an online system right now. So 5-10 cases, if it comes every day, we every day will have to send us thing saying that we got 5 cases of cholera today. The government will get alerted. So sentinel sites को concept चाहिँ त्यही हो कि एउटा ठाउँबाट आउँछ अनि त्यो इन्फर्मेसन दिने अनि त्यो इन्फर्मेसनको आधारमा चाहिँ गभर्मेन्ट विल थिङ्क ओके कहाँबाट आयो फ्रम गोकर्णेश्वर एरिया सो गोकर्णेश्वर एरिया दे लुक फर द डिजिज एन्ड दे ट्राई टु कन्टेन इट सिमिलरली सेन्टिनल साइट्समा चाहिँ नट अल हस्पिटल आर चुजन फर इक्जाम्पल NMC is a sentinel site for EWARS in Nepal for major diseases. But if there is another hospital, say Sankarapur Hospital is there nearby NMC, that is not a sentinel site. If 5 cases of cholera come to Sankarapur Hospital, it might not be reported. But if 5 cases comes to NMC, it will be reported. So what is the difference is that they know that more people will come to NMC because it's a medical college, right? So they have chosen that as a sentinel site. They want to limit that expenditure and actually get the picture of what is the disease pattern in the community. So that's sentinel site. Buzil?
Awesome. Thank you, sir.
Okay. We'll be studying about sentinel surveillance more in yours. I think I'll be taking that class later on. Okay. The next. So So vaccination, vector control, surveillance. I've talked a lot about vaccination, surveillance. Let's talk about vector control. So how do we control the vector? How do we do by vector controlling that? Reduce the vector density to reduce the transmission. Naturally, if the more numbers of mosquitoes are there, likelihood of the high number of mosquitoes biting many people is very high. So reduce the density, number one. So how do we reduce the density? Kill the adult mosquito. That's the very, very short-term immediate action. Anti-malarial spray, anti-mosquito spray and all that really works. Long-term would be vector reducing breeding pattern. So for reducing the breeding areas, teaching people about Aedes mosquito, community participation and all. Like, I don't know if this opportunity has been taken by the government or not, but lockdown period would have been a wonderful period to reduce the dengue this year. We could have asked, I don't know, maybe I can suggest the people who might know in the government, we can ask them to be vigilant about dengue this time. Control the dengue breeding sites, any water sites, right? So Aedes mosquito, it's the same thing. Aedes mosquito, last year Aedes mosquito with the virus might be there right now in my surrounding. So if you're able to clean it by community participation, teaching people and all, subsequent breeding season, the disease might not occur. So long-term means that. So we can do it in this way. Now, not all anti-mosquito techniques work for all type of mosquito, okay? The techniques used for malaria control is very, very, very different to technique used for dengue or yellow fever. I'll be talking about in more in detail in my class for dengue, but just try to understand that, okay? So one is vector control. So basically we want to reduce the vectors, so transmission is less. Another is surveillance to detect early. Basically, whatever type of surveillance, sentinel site surveillance, active surveillance, passive surveillance, whatever you do, basically it is for early detection and control of spread. You want to pick it up as early as possible, okay? So vaccination. Now, a little bit about yellow fever vaccine. It's one of the most unique vaccine, I call it. Why? Because they require proof while traveling, okay? Vaccination is a very important means of preventing yellow fever. In high-risk areas where vaccination coverage is low, prompt recognition and control of outbreak using mass immunization is critical for preventing an endemic. See, if there are 5 cases in a community, that 5 cases will not be able to transmit the disease immediately next day. It will take somewhere around 2 weeks, 8 to 12 days in the mosquito, 3 to 4 days. What is the incubation period of yellow fever? What is the incubation period?
3 to 6 days.
3
to 6 days. So roughly around 15 days, at least 10 to 15 days at least is needed for that one person to transmit the disease to another. 8 days minimum in the mosquito, and then 3 days minimum in the person. And then only that person is able to spread. And that too, they don't spread for a long time, just 3 to 4 days. So if one person was infected, spreading it to other, it will take time. Now, what it means over here is that if there are 5, 10, 15 cases in a high-risk area, let's say Kathmandu is a high-risk area, we've got Aedes mosquito. Do we have Aedes mosquito in Kathmandu? Do we have Aedes mosquito in
Yes.
Kathmandu?
Yes, sir.
Yes, right. It is very, very endemic in Aedes is very, very endemic in Kathmandu. That's why we got dengue last year so much, right? So we've got the Aedes mosquito. We don't have a yellow fever. So we've got the host, we've got the vector, we don't have the agent. Host is there. Environment is favorable. Human beings are there as the host. Environment is absolutely favorable. Next month onwards, it will start to rain more. It will be more hot, more warm, more humid. Everything will be favorable for yellow fever. So mosquitoes will be there. But the only thing missing is agent. So once that agent comes in over here and our system picks it up within 5, 10, 15, 20, 30, 50, or let's say 100 cases, controlling it will be much easier because spread is not, it will not explode every day. It will be in phase. One level outbreak and another level outbreak after a few days, another level. So if we are able to contain it with mass vaccination, it really works over here with yellow fever, okay? And if chances of getting yellow fever is really high, that is the thing, say someone who was born in Brazil will get vaccinated once they are born. So that's how they're controlling it. It's important to vaccinate 80% or more of the population at risk to prevent the transmission in the region. Why 80%? We want that herd immunity. Okay. Several vaccination strategies are used to protect against the outbreak. Routine infant immunization, mass vaccination during the outbreak or vaccination of the travelers. These things will cover it. So 3 or 4 disease name and you have to pick yellow fever over there. So it's a live previously 4 years, I think, not even 4 years ago, it was only for 10 years, recommended for 10 years only previously. One vaccination after 10 years it was said, but now it's single dose. Within 10 days, 80%, within 2 weeks or 3 weeks, it's about roughly 99% of protection is there, they say. And that protection is lifelong, they say, right now. So right now they don't recommend, WHO does not recommend, or nobody recommends second vaccination. One vaccination is enough. So we could really eradicate this disease. Side effects, okay, let's not talk about it. I think it's not that really important. For one reason, I'll just take a few minutes of extra time. Yellow fever in travelers, this is really important, and because it's really unique. The yellow thing that you see over here, light yellow. Can you distinguish this light yellow? Light yellow, sun here. India, Nepal, China, Pakistan, majority of Middle East, most of the non-sub-Saharan, the northern or the southern African region, few Australia. These are all countries in the world where yellow fever can occur. Why? Because mosquito is there. And you see these dark yellow over here. These are the